My name is Dr. Oksana Gauthier. I'm a physician here at Orthopedic Partners. And if you're watching this video, it's likely because your doctor has recommended an epidural steroid injection as a treatment option for your spine condition, and you'd like to know more about the process.
So an epidural steroid injection is a 5 to 10 minute fluoroscopic guided injection to treat your spine condition. Most injections are ordered after you have failed to improve with conservative treatments such as physical therapy or medications. It's part of a comprehensive treatment program that helps you improve your pain levels, your function, so that you're able to get back to doing the things that you love to do.
It's really common to have apprehension and anxiety prior to this procedure, so I want to allay any concerns that you may have.
There is a small risk of bleeding, there's a small risk of pain, there's a small risk of infections
And damage to the surrounding tissues because the skin is pierced by a small needle.
This is done safely under an X-ray machine, which guides the needle down to the location that we need to be.
We do all that we can to try to mitigate those risks and prevent adverse events.
Before the injection, we will review any medications and your allergies. We may ask you to stop medications such as blood thinners. For the injection, you will want to continue all your other medications, such as the ones to control your blood pressure or for diabetes.
On the day of the procedure, you'll be escorted to a pre-procedure area where one of our fantastic nurses will take your vital signs, review any medications, and possibly ask you to change into a gown. The physician will explain the procedure in detail, answer any questions, and address any concerns that you might have. After reviewing your medical record, including imaging and a consent process, you will then be taken to the procedure area. We will help you up onto the table. The X-ray machine is placed above you, and we will visualize the correct location of your spine. The skin is sterilized with a cold, wet solution and draped. A small amount of anesthetic is used to numb the area. The needle is then moved to a target location using intermittent X-ray images. When in the correct place, contrast is typically injected to make sure that the needle is around the nerve and there is no placement into a small blood vessel. Most patients feel a pressure during the procedure, but if there's any significant pain at any point in time, steps are done to make the patient more comfortable. Again, pressure is expected while pain is not. The medication is then injected, typically a numbing medication and then a steroid. The needle is removed, the skin is cleansed, and a small Band-Aid is applied. On the day of the injection, there may be local pain and local site reaction. It does take a couple of days to take full effect, but some patients do have immediate relief. You will want to continue all your other medications as prescribed by your physician. Immediately after the injection, you may feel some weakness in the back or in the legs. That is from the numbing medication and does take a couple of hours to wear off. Please refrain from any heavy lifting or strenuous exercise the day of your injection. There is a small wound in the back, so don't take a bath, sit in a hot tub, swim, or submerge yourself in any form of water for at least 24 hours. Do not use a heating pad for the remainder of the day. Instead, use ice to manage your pain and any localized swelling or minor reactions.
It is okay to continue with exercise and any prescribed physical therapy the day after the injection. An epidural steroid injection can provide patients with significant relief, though it is usually done in a combination of other modalities. That treatment plan should be discussed with your physician for your specific case. After a patient's first epidural injection, thankfully, most patients do have a sigh of relief and they say, hey, that wasn't that bad. When I think about patients and their pain, I think about the loss of their day-to-day function. You lose a day of having fun with your kids, playing on the floor. You lose a day of going outside and taking a nice walk because your back hurts.
But with this treatment option, you really can go back to doing the things you love to do and living your life in full motion again.